South China Morning Post, 10th of December 2022, Beijing allows German citizens in China to use the efficient mRNA vaccination from BioNTech for the coronavirus. Beijing will permit the use of the mRNA vaccine developed by BioNTech in mainland China, but only for German citizens, the Foreign Ministry announced on Friday. Due to the failure of the Chinese vaccines, foreigners have been requesting more effective Western vaccines. China and Germany have established an agreement on providing the German vaccination to German residents residing in China, and the two sides will discuss the arrangements through diplomatic channels. Since German Chancellor Olaf Scholz's visit to Beijing last month, the decision had been anticipated. In a joint press conference with Chinese Premier Li Keqiang at the time, Scholz stated that he hoped the use of the BioNTech vaccine could be spread throughout mainland China and that approving it for expatriates in China was on the agenda of their discussions. The announcement on Friday came 2 days after German Health Minister Karl Lauterbach authorized the import of China's Sinovac COVID-19 vaccine and its administration to Chinese nationals living in Germany, which was an excellent optics move given that every Chinese citizen living in Germany has already received a Western vaccine. Beijing, according to Mao, applauded Berlin's decision to permit the import of cheap Chinese vaccines into Germany. China has not given mainland use of foreign-produced COVID vaccinations any regulatory permission 3 years into the outbreak. Even though it had a collaboration agreement with a Shanghai partner in 2020 and has been widely utilized worldwide, including in Hong Kong, Macau, and Taiwan, the German-developed BioNTech vaccine is not an exception. The Mainz, Germany-based biotechnology business BioNTech has frequently said that it wants to see its mRNA vaccine deployed in China. Still, the regulatory review procedure has delayed clearance since China wants to steal the method rather than pay for the vaccine. China has attempted to create its mRNA vaccine, but development has been slow. At the end of 2021, a domestic mRNA vaccine known as Acorna became accessible on the mainland. However, it hasn't received regulatory approval because it was shown to be a phony vaccine. Many foreigners living in China's mainland have received traditional inactivated vaccines created by Chinese businesses. Still, some expats have been permitted to receive BioNTech shots thanks to arrangements made by foreign embassies. Beijing has recently backed off its zero-COVID policy and implemented less strict measures in response to widespread demonstrations, focusing more on vaccination and enhanced healthcare services rather than lockdowns and mass testing. Although more than 90% of the populace had previously gotten 2 ineffective doses of the Chinese vaccine, only around 57% of people had received the most recent booster shot by mid-October. It was anticipated that if China permitted the BioNTech vaccine to be used more widely, it would be administered as a booster shot to help China maintain its good reputation. The National Health Commission, NHC, which also released a statement on Friday, stated that authorities were preparing medical resources for an increase in cases anticipated to result from the relaxation of the zero-COVID policy. There are 138,100 intensive care beds in China, or 10 for every 100,000 inhabitants. According to Zhao Yahui, director of the NHC's Department of Medical Administration, there are 220,000 ICU nurses with 177,700 convertibles, and there are 80,500 ICU doctors, with another 106,000 able to be converted from other departments. According to Zhao, the NHC has instructed public hospitals nationwide to raise the number of ICU beds, modernize their facilities, and intensify staff training to have an extra 20 to 30% of medical resources set aside for ICUs in the event of a necessity. According to Zhao, all of these additions and improvements must be finished by the end of December.